We've seen dozens of COVID cases in the White House, and we know a lot of the names of the folks who've contracted the virus. People like Hope Hicks, senior aide in the White House, one of the president's closest confidants. Housing and Urban Development Secretary Ben Carson, who was quite sick. Presidential lawyer and conspiracy theorist Rudy Giuliani. Of course, there was Donald Trump himself, who was quite famously hospitalized with the virus. All of those people received top-notch medical care, including care that's not available generally to the public. Today, though, we learned more about another White House COVID patient, someone you probably haven't heard of, someone who isn't famous and who isn't coming out of this ordeal saying he feels 20 years younger, like the president did. His story is detailed by Jennifer Jacobs, senior national political reporter at Bloomberg, who has broken many of the stories of COVID in the White House, and she's here with us tonight. Jennifer, first of all, you've been doing incredible reporting on this beat, as strange as a beat as it may be. Can you tell us about the Mr. Creed, the head of White House security, and his battle with this illness?
Well, he's one of the White House officials that didn't come out of this with very few consequences. He actually had some very severe consequences. So he's the head of White House security, which is his role is the person that handles personnel security, clearance to come onto campus, onto White House campus, passes and things like that. And he works very closely with the Secret Service on security matters around the campus. He works in a SCIF in a building near the White House, on the White House campus. And we reported in October that he'd been hospitalized in September with the coronavirus. And that's pretty much all we knew about him until recently. We were alerted to a GoFundMe page that a family friend of his had created to raise money for him. And we verified that this GoFundMe page was indeed legitimate and valid. And the family friend outlined in the public documents on the GoFundMe page some of the consequences of what had happened to him during his 3 months in the hospital. And one of the consequences was he had some complications from the coronavirus, and he needed an amputation. He lost his big toe on his left foot, and on his right, he lost his right foot as well as the lower part of his leg. So he had some very severe consequences, is in a rehabilitation facility now near Washington, according to this family friend.
Creed Bailey, who's this gentleman's name and who you reported on. I remember reading your piece back in October about him. I had not encountered people that I knew who had ended up with amputations or had not sort of seen that firsthand until this. The GoFundMe page is striking. I mean, this is someone who works in the White House with a pretty serious and important job who now appears to be facing very significant medical debt.
Right. So I wasn't able to talk to the family. His family is very private and has asked the White House to not publicize his case. But we know from what his family friend wrote on the GoFundMe page that she says he has staggering medical bills. Of course, he's a federal employee with good health insurance. But she did say that as a consequence of his amputations, that he needs various adjustments to his home. He needs a different shower modification in his bathroom. He needs handrails. He needs his car modified to accommodate a wheelchair. So she said his medical costs have just really racked up.
More broadly here, I mean, one of the things that your reporting has been so important for is just reminding everyone that the White House is a workplace. It's a workplace where a whole bunch of people work, reporters like yourself, individuals like Mr. Bailey, folks that are in the staff of the kitchen. And all those folks are being, they have to do their job. And they're often, it seems, because of White House policies, which appear to be charitably fairly lax, often it seems being exposed to a significant amount of danger of viral transmission.
Right. There have been a lot of White House officials who have been exposed to this, even though they're in one of the most secure compounds in the world. We know of at least 4 dozen people connected to this, but we just don't know a whole lot of details about how Creed Bailey contracted the virus. I don't know the origins of that. Yeah. So it's unclear where he got it, but we do know that he worked in a secure office on the White House campus, was diagnosed in September. And remember, this was pre-election. I'm told that Creed Bailey is a very, very strong supporter of President Trump. And when he contracted this virus and was in the hospital, this was at the point of time when the president was telling the public, remember, he tweeted when he got out of Walter Reed Medical Center, don't be afraid of this virus. We have all sorts of knowledge and drugs to take care of people. And at the same time, Creed Bailey was in the hospital.
Is your sense that any corner has been turned in the White House in terms of its protocols? I saw complaints from the White House Correspondents Association just the other day that Kristi Noem, the governor of South Dakota, sort of walked through on a tour unmasked in a very, very close and confined space. Have things improved there protocol-wise?
Well, I know from my reporting that over the months, things did improve as cases broke out here and there, starting way back in March when one of the vice president's aides got sick, and then another vice president, the press secretary to the vice president, got sick in May. Different protocols were put in place over those months. I do know that White House staff wear masks when we're walking around in the hallways. There's hand sanitizer, free masks. There are many people who take extreme precautions in the White House, including some of the people who did get the coronavirus are among some of the people who were the most careful about the virus.
Yeah. Well, getting the virus is not some badge of being insufficiently vigilant. The thing is implacable. Jennifer Jacobs, who is a one-woman test and trace team on the White House beat. Great reporting, and thank you so much. I really appreciate it.
Thank you.